Hello, I'm Dr. Z. Paul Lorenc, a board-certified aesthetic plastic surgeon practicing on Park Avenue in Manhattan in New York City. Welcome. Today's topic is, what is a brow lift? Well, a brow lift is very different in 2017 than even 5 years ago. It's an endoscopic approach with minimal incisions in the scalp where they're not visible incisions. And what a brow lift does, it simply elevates the brow. But what it also does, it minimizes the heaviness between the brows and also the hyperactivity of these muscles that create those 11s. So I can address both the malposition of the brow and also the heaviness or the hyperactivity of the muscles causing the 11s. There are different techniques. As I mentioned, the endoscopic brow lift is really the state-of-the-art technique, actually developed by myself in 1994. It's an endoscopic approach with tiny little incisions within the scalp, and using an endoscope, looking at all of the structures underneath, I'm able to elevate the brow and also minimize the activity of these muscles that create these lines. Who's a candidate? I've operated on patients in their late 20s for elevation of the brow. And in those patients, this is really more of a genetic issue, but typically these are patients in their 50s and 60s, where as we age, the brow descends. There's hooding of the upper eyelids that's attributed really to the descent of the brow, and also the hyperactivity of the muscles between the brows. So the candidate is really anyone who has excess activity of the muscle or hooding of the brow. Will you look surprised after a properly executed brow lift? Obviously not, but it's all about judgment. It's about the technique, execution, and most importantly, the judgment. So in my practice, we don't have patients who come back and complain that they look surprised, because you just don't do that. But again, it goes back to judgment and technique. The appearance after the procedure, immediately after the procedure, you do have some swelling of the forehead, very little black and blue, mostly because the procedure is done at a particular plane that doesn't cause any bleeding intraoperatively or postoperatively. So there's some swelling. Majority of the swelling disappears in 3 to 5 days. As far as scarring, not perceptible. Scars are within the hairline, in the center and also to the side. By the way, there is no hair loss with this particular procedure. That's one of the misconceptions that patients have, that I will have a lot of hair loss with this procedure. And it's not true, again, because of the design of the procedure and the level of the section that I execute. How long do the results last? Really, for the rest of your life. I have patients where I've performed this procedure over 20 years ago that I still see in my practice, and the brow is still in good position. So it really should last for the rest of your life. Will you still need Botox? Much less Botox or Xeomin or Dysport, and sometimes, depending on the aging pattern, you might not need anything after a well-executed endoscopic brow lift. Is there pain? Some discomfort, just like any surgical procedures, well controlled with pain medications post-op. Really within 2-3 days, you can change over to Tylenol. As far as recovery, 3 to 5 days where you have to take off from work. After that, you can resume all activity except for heavy exercise, which usually you can do at 14 days post-operatively. Cost range, very wide range across the country, from $7,500 to $15,000. Depends on what else is being done. Depends on the additional cost of anesthesia or the facility fee. Thank you for your time. I hope this was helpful in your understanding of what a brow lift involves.